Stroke is the third biggest cause of disability in Wales, which is why the Welsh Government and the Stroke Association have teamed up to launch the Lower Your Risk of Stroke campaign across pharmacies in Wales. The launch took place at the Cardiff Bay branch of the Co-Operative pharmacy this morning and aims to raise awareness in Welsh communities of stroke-specific risk factors. A stroke is a brain attack which happens when the blood supply to the brain is cut off, caused by a clot or bleeding in the brain, which can cause devastating consequences to the victim and their family. But the Stroke Association stresses that it is preventable.
The Lower Your Risk of Stroke campaign is a joint partnership between Public Health Wales, the Community Pharmacy Wales community and the Stroke Association, and also other health boards. Every one of the health boards are also collaborating, and the idea is very much to raise awareness amongst the general public about the three key specific risk factors for stroke. That is high blood pressure, atrial fibrillation, which is an irregular heartbeat which can be detected by just touching the pulse. And if that is happening, then it's important that people go and have that checked and, if need be, treated, because AF can lead to very severe strokes and even fatal strokes. And that is why it's so important to work with community pharmacy, because not everybody goes to the GP, sometimes for various reasons, but people do come to the pharmacy. And if pharmacists can help to raise awareness and can help to inform the public about what they can do to prevent a stroke, then we will be reaching many more people that way.
Not everybody is willing or has the time to go and speak to their GP, but are able to pop down to their local pharmacy and take advice from the pharmacist. We offer, a range of services here, from just a small chat in the consultation room to give them advice about their medicines, or go in more depth and carrying out sort of medicine use reviews, where we go through each one of their medications in turn and check if they understand why they're taking their medication, what, is the benefits of them taking it, and just if they have any questions themselves that they haven't been able to ask their GP about, they can certainly confide and ask us.
The Deputy Minister for Health officially launched the campaign, speaking to stroke survivors and expressing his compassion for the cause.
Yes, my own father died from stroke, and I saw him recover from a stroke, go back to work, and I saw him have another stroke that meant he left work, and he then had another stroke and had a fairly long-term disability for the rest of his life until a final stroke actually killed him. So I know very much what it is to see the impact of that. What's also been important about today is to meet other survivors who, with the Stroke Association, are being supported, because the NHS has a job to do about helping people to recover afterwards, to be medically fit. But it's also about helping them to live their lives again. So it's that social recovery as well, about making friends, still having a support network, still having a life that you actually want to live. And if you talk to the stroke survivors here today, they'll tell you about what they're still able to do with their life. To travel, to see friends, to be part of a family, when a number of these people, without the help and support of the health service, would not be here. And this campaign is about preventing people from having a stroke in the first place, as well as then thinking about what the health service could and should do afterwards.
There are over 700 pharmacies across Wales. They are in the high street. They are friendly people who help the public. And we have so many positive stories of stroke survivors and the carers who are really able to control the medication, to review the medication, to get the advice they need because of the friendly pharmacist. So we really value this partnership. We think it's absolutely important.